हाय एवरीवन। आज हम डायबिटीज मेलाइटस एंड अदर डिजॉर्डर ऑफ मेटाबॉलिज्म पढ़ेंगे। इसमें डायबिटीज मेलाइटस में कम से कम हाइपरग्लाइसेमिया हाइपरग्लाइसेमिया देखेंगे। इंसुलिन इंसुलिन एक्शन, क्लासिफिकेशन ऑफ डायबिटीज, क्लिनिकल प्रेजेंटेशन ऑफ डायबिटीज, डायग्नोसिस इन्वेस्टिगेशन ऑफ डायबिटीज, ट्रीटमेंट ऑफ डायबिटीज। ओके, इतना हम कोशिश करेंगे कवर करने के लिए। सो डायबिटीज मेलाइटस, हाइपर ग्लाइसेमिया, इंसुलिन एंड इंसुलिन एक्शन। इंट्रोडक्शन। Diabetes mellitus (DM) is a syndrome of a chronic hyperglycemia due to relative insulin deficiency, resistance, or both. It affects more than 220 million people worldwide, and it is estimated that it will affect 440 million by the year of 2030. Diabetes is usually irreversible, and although patient can lead to reasonably normal lifestyle, its late complication result in reduced life expectancy and a major health cost. These include macrovascular disease leading to an increased prevalence of coronary artery disease, peripheral vascular disease and strokes, microvascular damage causing diabetic retinopathy, nephropathy. Nep- Neuropathy is another major complication. Insulin structure and secretion. Insulin is a key hormone involved in the storage and controlled release within the body of the chemical energy available from food. It is coded for on chromosome 11 and synthesized in the beta cell of a pancreatic islet. The synthesis, intracellular processing, and secretion of insulin by the beta cell is typically of the way that the body produces and manipulates many peptide hormone. Figure 20.2 illustrate the cellular event triggering the release of insulin containing granules. After secretion, insulin enters the portal circulation and is carried to the liver, its primary target organ. About 50% of secreted insulin is extracted and degraded in the liver. The residue is broken down by kidney. C-peptide is only partially extracted by the liver and hence provide a useful index of the rate of insulin secretion, but is mainly degraded by the kidney. An outline of a glucose metabolism. An outline of a glucose metabolism. Blood glucose level are closely regulated in health and rarely stray outside the range of 3.5 से लेकर के 8.0 मिलीमोल्स पर लीटर, जो कि आपका 63 से लेकर के 144 mg पर dl. Despite the varying demand of food, fasting, and exercise, the principal organ of glucose homeostasis is liver, which absorb and store glucose as glycogen in the post-absorptive state and release it into the circulation between the meals to match the rate of glucose utilization by peripheral tissue. The liver also combines three carbon molecules derived from breakdown of fat, मतलब glycerol, muscle glycogen, that is lactate, and protein alanine, into six carbon glucose molecule by the process of gluconeogenesis. Glucose production. About 200 gram of glucose is produced and utilized each day. More than 90% is derived from liver glycogen and hepatic gluconeogenesis, and the remainder from renal gluconeogenesis. Then glucose utilization. The brain is the major consumer of glucose and its function depend upon the uninterrupted supply of this substance. It's require 1 mg per kg body weight per minute or 100 gram daily in a 70 kg man. Glucose uptake by the brain is obligatory and it is not dependent on insulin, and the glucose used is oxidized to carbon dioxide and water. Other tissues such as muscle and fat are facultative glucose consumer. The effect of insulin peaks associated with meal is to lower the threshold of glucose entry into the cell. At other times, energy requirement are largely met by fatty acid oxidation. Glucose taken up by muscle is stored as glycogen or metabolized to lactate or carbon dioxide and water. Fat uses glucose as a source of energy and as a substrate for triglyceride synthesis. Lipolysis releases fatty acid from triglyceride together with glycerol, a substrate for hepatic gluconeogenesis. Hormonal regulation. Part of a beta cell, figure 20.1. Part of a beta cell. The ribosome manufacture proinsulin from insulin mRNA. The hydrophobic pre-portion of a pre-proinsulin allows it to transfer to the Golgi apparatus and is subsequently enzymatically cleaved up. Proinsulin is parceled into secretory granule in the Golgi apparatus. These mature and pass towards the cell membrane where they are stored before release. The proinsulin molecule folds back on itself and is stabilized by disulfide bonds. The biochemically inert peptide fragment known as connecting peptide split off from proinsulin in the secretory process, leaving insulin as a complex of a two linked peptide chain. Equimolar quantities of insulin and C peptide are released into the circulation via the regulated pathway. A small amount of insulin is secreted by the beta cell directly via the constitutive pathway which bypasses the secretory granules. Then coming to hormonal regulation. Insulin is a major regulatory of intermediary metabolism, although its actions are modified in many respects by other hormone. Its action in the fasting and postprandial states differs. Figure 20.3. In fasting state, its main action is to regulate glucose release by the liver, and in the postprandial state, it additionally promote glucose uptake by fat and muscles. The effect of a counter-regulatory hormone, glucagon, epinephrine, adrenaline, cortisol, and growth hormone, is to cause greater production of glucose from the liver and less utilization of glucose in fat and muscles for a given level of insulin. Then glucose transport. Bhagavan. Cell membrane are not inherently permeable to glucose. A family of specialized glucose transporter GLUT protein carry glucose through the membrane into the cell. GLUT1 enables basal non-insulin stimulated glucose uptake into many cells. See figure 6.29. GLUT2 transport glucose into the beta cell, a prerequisite for glucose sensing, and is also present in the renal tubule and hepatocytes. GLUT3 enables non-insulin mediated glucose uptake into the brain neuron and placenta. GLUT4 enable much of the peripheral action of insulin. It is a channel through which glucose is taken up into the muscles and adipose tissue cell following stimulation of a insulin receptor. Figure 20.4. Figure 20.2 Local forces regulating insulin secretion from beta cell. Glucose enters the beta cell via the GLOT2 transporter protein, which is closely associated with the glycolytic enzyme, that is glucokinase. Metabolism of a glucose within the beta cell generate ATP. ATP closes potassium channel in the cell membrane. A. If the sulfonylurea binds to its receptor, this also closes potassium channel. Closure of a potassium channel predisposes to cell membrane depolarization, allowing calcium ion to enter the cell via calcium channel in the cell membrane. B हो गया. The rise in intracellular calcium triggers activation of a calcium dependent phospholipid protein kinase, which via intermediary phosphorylation steps lead to fusion of the insulin containing granule with the cell membrane and exocytosis of insulin rich granule content. Similar mechanism produce hormone granule secretion in many other endocrine cells. Fasting and postprandial. Okay, figure 20 point. फास्टिंग नेगेटिव इफेक्ट, पोस्ट प्रेंडियल पॉजिटिव इफेक्ट. ओके ठीक है. फास्टिंग का साइन ये. ओके. फास्टिंग एंड पोस्ट प्रेंडियल इफेक्ट ऑफ इंसुलिन. Insulin concentration are low and it acts mainly as a hepatic hormone, modulating glucose production via glycogenolysis and gluconeogenesis from the liver. Hepatic glucose production rises as insulin level fall. In the postprandial state, insulin concentration are high and it then suppresses glucose production from the liver and promote the entry of glucose into the peripheral tissue, increases glucose utilization. Now figure 20.4 insulin signaling in peripheral cell. Example, muscle and adipose tissue. The insulin receptor consists of alpha and beta subunit linked by disulfide bridges, top right of a figure. The beta subunits straddle the cell membrane. The transporter protein GLOT4, bottom left of the figure, is stored in intracellular vesicles. The binding of insulin to its receptor initiates many intracellular action, including translocation of these vesicles to the cell membrane, carrying GLOT4 with them. This allows glucose transport into the cell. The insulin receptor. The insulin receptor. This is a glycoprotein 400 kilodalton coded for on the short arm of a chromosome 19, which straddle the cell membrane of a many cell. Figure 20.4. It consists of a dimer with two alpha subunit, which include the binding site for insulin, and two beta subunit which traverse the cell membrane. When insulin binds to the alpha subunit, it induces conformational change in the beta subunit, resulting in the activation of a tyrosine kinase and initiation of a cascade response involving a host of other intracellular substrate. One consequences of this is migration of a GLOT4 glucose transporter to the cell surface and increased transport of glucose into the cell. The insulin receptor complex is then internalized by the cell. Insulin is degraded and the receptor is recycled to the cell surface. Classification of a diabetes. Diabetes may be primary मतलब idiopathic and secondary मतलब secondary. Table 20.1. Primary diabetes is classified into type 1 diabetes and type 2 diabetes. Type 1 diabetes, which has immunopathogenesis and is characterized by severe insulin deficiency. Type 2, which result from a combination of insulin resistance and less severe insulin deficiency. The key clinical feature of the two main forms of diabetes are listed in table 20.2. Type 1 and type 2 diabetes represent two distinct diseases from the epidemiological point of view, but clinical distinction can sometimes be difficult. The two diseases should, from a clinical point of view, be seen as a spectrum, distinct at the two ends but overlapping to some extent in the middle. Hybrid forms are increasingly recognized, and the patient with immune-mediated diabetes, that is type 1, may, for example, also be overweight and insulin resistant. This is sometimes referred to as double diabetes. It is more relevant to give the patient the right treatment on clinical grounds than to worry about how to label their diabetes. The classification of a primary diabetes continue to evolve. Monogenic form have been identified. See page number 1007. In some cases, with significant therapeutic implication, although secondary diabetes account for barely 1 से लेकर के 2% of all new cases at presentation. It should not be missed because the causes can sometimes be threatened. All form of diabetes derived from inadequate insulin secretion relative to the needs of the body, and progressive insulin secretory failure is characteristic of both common form of diabetes. Thus, some patients with immune-mediated diabetes type 1 may not at first require insulin, whereas many with type 2 diabetes will eventually do so. Type 1 diabetes mellitus epidemiology. Type 1 diabetes is a disease of insulin deficiency. In Western countries, almost all patients have the immunomediated form of a disease, otherwise known as type 1A. Type 1 diabetes of a disease of a childhood, reaching a peak incidence around the time of a puberty, but can present at any stage. A slow burning variant with slower progression to insulin deficiency occur in later life and is sometimes called latent autoimmune diabetes in adult LADA. LADA may be difficult to distinguish from type 2 diabetes. Clinical clues are linear build, rapid progression to insulin therapy following an initial response to other therapy, and the presence of a circulating islet autoantibodies. The highest rate of type 1 diabetes in the world are seen in Finland and other northern European countries, and on the island of Sardinia, which for unknown reason has the second highest rate in the world. Figure 20.5. The incidence of type 1 diabetes appears to be increasing in most population. In Europe, the annual increase is of ऑर्डर ऑफ 2 से लेकर के 3% एंड इज मोस्ट मार्क्ड इन चिल्ड्रेन अंडर द एज ऑफ 5 years. WHO estimated in 1995 that there were 19.4 million people with type 1 diabetes and that the number will rise to 57.2 million by 2025. Diabetes mellitus and other disorder of metabolism. ओके, सो आज के लिए इतना ही. अगले बुक रीडिंग सेशन में हम डायबिटीज मेलाइटस एंड अदर डिजॉर्डर ऑफ मेटाबॉलिज्म देखेंगे. थैंक्स फॉर वॉचिंग.